My name is Robert W. O'Brien, and I'm originally from Minnesota. I'm a registered nurse, and I came to Phoenix on a travel contract with St. Joseph Medical Center. In my professional career, I guess I could best say there was two sides to me, and that there was my functional side, and I also had another side that was a secret and that I kept from everybody else. I was a RN addicted to narcotics and also alcohol. At some point, those two worlds would collide together. So my coming to Terros was basically a nurse that had lost their license that still needed some more services.
When we think about population health, we're thinking about our system of care at Terros Health, and really the major switch is moving from what historically has been a reactive system of care to creating a more proactive system of care. So if we're going to do that in an efficient and effective way, the 4-quadrant model gives us a conceptual way to think about the populations of people that we serve.
When I first came to Terros Health, I felt a real acceptance there. I was interviewed for intake, and it was decided that I would I would go through the SOP program and also relapse prevention. And so I'm happy that I did that, and Terros was great for that.
So when we think about the 4-quadrant model, it looks at our patient population from an integrated perspective. So it looks at our population from a perspective of what kind of behavioral health concerns do our people have, and what kind of physical health concerns do our people have, and then blending those together so we can deliver the right care to the right population. So looking at the 4-quadrant clinical integration model, when we look at quadrant 1, that consists of individuals who have a low severity, low risk, low complexity behavioral health and physical health condition. So for example, somebody who might have an adjustment disorder and a cold, for example, might be in that quadrant. Moving over to quadrant 2, that's comprised of individuals who have a high severity, high risk, high complexity behavioral health condition, but a low severity, low complexity, low risk physical health condition. So that might be somebody who has schizophrenia but is otherwise healthy. Moving over to quadrant 3, that is for individuals who have a high severity physical health condition, but a low severity, low risk, low complexity behavioral health condition. So that might be somebody with cardiovascular disease, COPD, diabetes, but otherwise no significant mental health concern. Quadrant 4 is for individuals who have both a high severity, high complexity, high risk behavioral health and physical health condition. So these are some of our patients who may suffer from schizophrenia, major depressive disorder, anxiety, along with diabetes, COPD, cancer, any type of chronic health condition would qualify for quadrant 4. Robert came to us, who I would say was probably in quadrant 2 with a substance use disorder, but otherwise fairly healthy. The good news with Robert is that I would say, as far as risk, severity, and complexity with his illness, he'd probably be in a quadrant 1 because he's moved on and is very successful in his career right now.
Now that I've been clean and sober for 8 years and my license has been reissued, I can't say enough good things about this program at Terros with their integrated services and their recovery programs. Just the helping hand and the acceptance was so important to me at a time like this. And they'll always be here, and I can always come back for whatever I needed here.
When I think about the compelling purpose of Terros Health, which is to inspire change for life, I think of Robert as one of our patients who came in initially for a substance use disorder, but he's coming back to us for his primary health condition, and we look forward to serving Robert for his life, and him being with us and us being his health home, not just for today or tomorrow, but for his entire life.